At T-Mobile, our critical mission is providing unparalleled 5G coverage for when connectivity is mission critical. Introducing T-Priority, America's best 5G network experience for first responders, even in times of congestion. More capacity, faster speeds, better coverage. T-Priority from T-Mobile, built for tomorrow's emergencies, ready today. Discover more at t-priority.com.
For qualifying organizations on eligible rate plans, coverage not available in some areas and may be impacted by emergencies.
This episode is brought to you by Prime Video. In the small town of Holland, Michigan, nothing is ever what it seems. Behind the tulip festivals and pretty houses lay dark secrets that threaten to tear a marriage apart. Nicole Kidman stars in this darkly twisted thriller about a wife and mother whose quest to uncover her husband's secrets may get her more than she bargained for. Holland, streaming on Prime Video March 27th.
Welcome to the Parent Footprint Show with Dr. Dan. I'm Dr. Dan Peters, your host, and we are excited to bring you our weekly podcast. We're at Parent Footprint. Our mission is to make the world a better place, one parent and one child at a time. At Parent Footprint, we believe the key to raising happy, healthy, and engaged kids is for parents to be happy, healthy, aware, and engaged themselves. And each week we have a wonderful guest who enlightens us about an area of expertise and passion that they have to help us parent with purpose and leave the best footprint for the next generation. I am excited to have my colleague, Dr. Deborah Ross-Swain, on the show today. The topic is, what if your child can't be a good listener? Exploring auditory processing. Now, Deb is quite an amazing person and professional. Dr. Ross-Swain is the former Chief of Speech Pathology at the University of California, Davis Medical Center and is now the owner and founder and president of the Swain Center for Listening, Communication, and Learning. Dr. Swain has over 35 years of experience in the area of auditory processing, learning, and early education. She is a nationally recognized speaker, a writer, researcher, and the author of 7 treatment books and manuals and 8 standardized tests for assessing various deficits with communication. I have almost all of those on my desk, and they are tremendous and huge and just a wealth of information. Deb, thanks so much for joining us on the show this morning.
Oh, I'm so happy to be here. Thank you for inviting me.
That was a mouthful. You have... One of the things that I tell everyone about you when you come up in the work is your wealth of knowledge and experience in the field. I mean, you have been doing this for so long, and I guess the first thing that I'm thinking of asking is, how has the field changed since you've came into it?
Well, the biggest thing that we notice is this increase in childhood communication problems. And when I talk about communication, I'm just not talking about expressive speech and language, but these children are presenting with a variety of issues that are ultimately impacting their learning and their socialization and their ability to move forward and go out and get jobs as we track them over their youth and their teen years. And so the portrait of a child has changed so much, and there are just so many variables now that we have to look at. But before, when I was a grad student and first entering in the profession, it was pretty clear. We worked with articulation disorders or expressive language disorders or fluency disorders. But now they're very complex with processing issues that are affecting outcomes, successful outcomes for them, both socially and academically.
So when we talk about processing a lot, and you and I talk about processing a lot, there's this concept of processing in general, and then there's different types of processing, and particularly we'll be talking a lot about auditory processing. How do you describe processing for parents and teachers?
Well, let's first talk about auditory processing, and let me just tell you what that is, and then how it kind of gets muddied a little bit. But simply, auditory processing is described by the professionals and by the researchers as really, truly what we do with what we hear, or how the ear speaks to the brain. And so for a while, the term central auditory processing was applied to this area, and that is specific to audiologists. Then later, there were task forces, and then the American Academy of Audiology came out with the term auditory processing to be used instead, because auditory processing in these terms are those things that involve the entire nervous system when it receives information through the auditory system. So it involves other things, higher cognitive levels, memory and attention and so forth. So when we talk about processing and I explain it to parents, then what I talk about is either auditory language processing or auditory information processing. And that is a better description of what we do with what we hear. Because when we talk about processing, we can't see processing. So if a child were to have an MRI or an EEG or any kind of technologically based study, their brains pretty much look similar to a person who doesn't have that difficulty. So what we see are behaviors, and the behaviors can look a lot like other types of problems, which is why we have to really do a comprehensive assessment here, because what we see is behavior. And so if the brain's not receiving the signal the way that the speaker is speaking it and intended for it to be received, then you're going to see it as a behavior, not following directions, saying huh or what, and so forth. So processing is how we get the signal from the external environment to a person's brain, and as Katz and Stecker and Henderson had said, it's what we do with what we hear.
Ooh, I like that. Okay, what we do with what we hear.
Right.
So that means that when my children don't listen to me, it doesn't just mean that they are being selfish and oppositional?
Well, no.
It could be more. It could be more than that.
It could be more than that, because you want to see a pattern of this. So we see red flags. We see red flags that a child may be having auditory processing weaknesses. We'll see behaviors not only in the classroom, but we'll see it at home. There'll be consistency. So, for example, red flags in the classroom can be something, some of the following. A child is not able to attend for a period of time to information that is age appropriate, and while their peer group is able to pay attention. They may not be able to follow 2-step or 3-step directions, which would be age level appropriate. They may look fatigued. They may slump in their seat. They may be daydreamy. They may need repetition of instructions, or they may need to have instructions, say, rephrased. They may have to have information that is presented not only auditorily but visual. So they need multi-sensory instruction for things that would be seemingly easy for their peer group. They may act out behaviorally with a low frustration tolerance. So when those patterns, we see them not only in the classroom, those patterns of behavior, you'll see them at home. And also they may say, huh, or what, or I don't remember, I didn't hear you. And they may be distracted easily by noise, where others can filter that out. So when we get a number of behaviors that are consistent in many areas of their life, then we have to look at it, because all of our children will ignore us, or they will be engaged in a something that's high interest, and what we have to say, and they're according to them, it may be low interest, so they're going to tune us out. But you see, we will see behaviors, and a teacher may raise these concerns with parents at a parent conference, or parents may see them at home and just feel that they're just not cooperating. They're not listening. And that's the word that I hear a lot from parents. My child just doesn't listen. And listening and processing can be used interchangeably. But when it becomes a concern and it's interfering with academic success or social success, then we really have to look at it very closely so that we can identify it, and then we need to do something with it.
Well, and I was going to wait to ask this difficult question that you and I grapple with often. So I heard a lot of things that, and they're not listening, and they're not paying attention. So, we have a very well-liked diagnostic category these days called attention deficit hyperactivity disorder, right? And so we have this sort of, I guess it's not really a joke in the different fields. It's like your child will get a label based on who they see. Go see a psychologist or a physician, you'll get ADHD. Go see a speech and language pathologist or an audiologist, you'll get a central auditory processing disorder. Everyone has different ways of looking at things. But this is actually a really, really serious issue because a lot of kids could look like they are inattentive when it's actually auditory processing, and then even prescribed medication when it's not an attentional issue.
Right. So auditory processing disorder can coexist with attention deficit hyperactive disorder, and another diagnosis that these children frequently get is learning disability. And so let me just give you a quick example of how this can be described as ADHD. So let's say a child has trouble with sound discrimination, and that just means that their brain doesn't allow them to hear differences between similar sounding words. So if I say shop, they might hear chop. Or if I say cold, they might hear gold. Or if I say pen, they might hear pan. So if we identify that they have a discrimination problem, then we know that when they're sitting in a classroom trying to listen to a teacher talk, say, an ongoing, kind of like a learning format where they're teaching them something new, and that child is misunderstanding, say, every fourth or fifth word and not able to get information from the context, then that child is trying to understand and store information that their brain is perceiving as nonsense, and it's not making any sense to them. So they will tune out because the human brain cannot attend to what it doesn't understand. It just can't. So if a child has, say, a discrimination problem and it's not understood and it's not identified, then what everyone is seeing is they're not paying attention. So that's why a comprehensive assessment is so essential to determine all the various skills involved in that processing system. We assess them and we determine what is contributing to that lack of attention, because that's the behavior that's being seen.
Yeah, well said. And I often, when doing feedbacks about testing, parents will say, I don't understand that these scores are much lower than I expected, and in real life they're much better at these things. And then I have to remind them that everything that their child has been tested on has to go through their visual or auditory processing system. So there can be glitches within the translation to get whatever the output is that we're looking for.
That's absolutely correct, because we have to help parents understand how these scores translate to functional outcomes.
Right.
And then also, children who really bright kids, well, that's another thing. We know that many children, probably most of the children that have difficulty with auditory processing skills, they have average or above average IQs. So they'll develop really keen compensatory strategies in order to, say, achieve certain academic successes. However, that takes its toll because these children tend to work overtime to listen, overtime to process, overtime to get their work done, and so it's exhausting to their system, and they just fatigue from putting in so much time and energy into processing and listening. And by the time they get home, they're just exhausted, or they act out quite a bit because they're frustrated from having to expend so much energy just to process to get through a school day.
Right, and I think it's key for our listeners to hear that what we often see from our kids is behavior. That's right. All we see. And as Correct. You said, just the exhaustion of taking in all this information all day long at school, it's depleting for many kids, and it just wears them down. So when we talk about school, where kids spend most of their days, how do these processing issues from your experience then affect a child's learning in the classroom?
Okay, so much of the learning and so much of the teaching is mouth to ear, and so what will happen is very frequently these children are going to have difficulty meeting academic goals and objectives. And so when it first presents itself, very often teachers will say, well, you've got a very bright child, they just need to try harder, or they need to pay more attention, or they need to spend more time with homework, or they just have to apply themselves. And so then there'll be a wait-and-see period, and the second half of the school year, they're still struggling. So they're going to have difficulty with a number of things, but they'll have difficulty with reading and spelling. They'll have difficulty with being able to read to learn. They will have difficulty doing, say, word math problems. They'll have difficulty just following directions on how to initiate, sequence through, and complete a task. A big hallmark red flag is they do okay when they get one-on-one instruction where they can get multiple inputs of information. But very often children are referred to me because they're just not doing well in the language arts domain. And they may be getting RSP for reading support or math support. They may be in private tutoring, but they're just not succeeding. And usually, you said it best just a few minutes ago, it always translates over into some behavioral issue where parents are struggling to parent their children because they're falling apart, they have tremendous homework hassles, or probably worse for the child is they're having trouble socially. And so they're very frustrated and pretty sad, and then their level of self-confidence has been eroding as they're going through this as well.
Well, and you just hit on another very important point, social issues. I don't think we think about the connection between auditory processing and social behavior and relationships. That's real important. Can you tell us about what you see?
Sure. When we see difficulty with children with social relationships and we do a comprehensive assessment, we can pretty well pinpoint what's going on. So I gave a few moments ago, I gave an example of trouble with discrimination. And so if children are missing words or mishearing words in a classroom, they're going to mishear them in a social environment, like out on the playground or in a gymnasium. And so they will maybe mishear a word, and they've told a joke, or someone's told a joke and they miss the joke, or they don't laugh at jokes, or they laugh at the wrong time, or they also have trouble generalizing information, remembering those social rules and those social nuances. Some children can't understand tone of voice, and when that happens, then they're going to really miss a cue. So there's a huge difference between dude and dude, and those kinds of things that give information to a child, knowing when to enter a conversation, when to exit a conversation. And once it's been perceived by their peer group that they're just not getting it socially, kids move on really fast. Mm-hmm. And these children are often left behind.
You've maxed out your 401k, you're contributing to an IRA, and making some other investments. You're ahead of the game and doing well. But where do you go from here? The same old story can only get you so far. If you want a new take from a new type of financial professional, we invite you to get a fresh perspective beside an agent with the backing of New York Life. Insurance, investments, retirement, and more. Visit NYL.com to learn more. Investments are offered through registered representatives of NYLife Securities, LLC. Member FINRA SIPC, a New York Life company.
Support comes from ServiceNow. We're for people doing the creative work they actually want to do. That's why this ad was written and read by a real person and not AI. You know what people don't want to do? Boring, busy work. Now with AI agents built into the ServiceNow platform, you can automate millions of repetitive tasks in every corner of your business, IT, HR, and more, so your people can focus on the work that they want to do. That's putting AI agents to work for people. It's your turn. Visit ServiceNow.com.
This episode is brought to you by Honda. Introducing the all-new, all-terrain Honda Passport Trail Sport, the most off-road capable Honda Passport Honda has ever dreamt up. The Passport features increased ground clearance, roof rails on all trims, and available specially developed all-terrain tires. And you'll stay comfortable with tri-zone climate control and available features like heated and ventilated front seats and a panoramic moonroof. Learn more at honda.com/passport.
So another category I'm going to throw in here, just because we know how complex kids can be and how complex their different functioning systems are, is another area of your expertise is autistic spectrum. And while we're not going to focus on that for this show, where is the line? You don't have to have an auditory, just because you have an auditory processing issue that leads to social processing issues doesn't mean you're necessarily on the spectrum, right?
Absolutely. You are absolutely correct. So there are certain criteria that a child must meet in order to receive an ASD diagnosis. The kids with processing problems, and by the way, kids who have an ASD diagnosis then almost always have difficulty with processing. But the children that we're talking about are those kids who have that wouldn't even be considered on the ASD diagnostic group continuum, but they just can't pull the whole thing together as far as learning, communication, and social skills, which, by the way, many do have oral communication problems because they can't organize and express their thoughts and needs and desires. They may have difficulty accessing their vocabulary, their readily available vocabulary. They may have what appears to be word-finding issues. So you'll see these subtle expressive communication problems, but the ones that everybody sees most are with regard to just listening and understanding information as it comes through the auditory system. And then we get into reading and spelling problems and the whole literacy and dyslexia piece, because the relationship between processing and reading and spelling mastery or acquisition of mastery are well documented. So they go hand in glove. So when a child is having trouble learning or they're in special education for reading and spelling, I always say, just get a comprehensive processing assessment, because that will make things a whole bunch easier in terms of determining what interventions are going to be necessary for a child so that they can be successful learners.
Well, you're speaking to the choir with that one. So, we just have another. I was thinking that other diagnostic category, and then you said it. So then we have dyslexia. And I think for our listeners, one of the key take-homes here as you're trying to learn more about your children and be more aware parents for your kids is that there are all these different systems, and sometimes they overlap. And a lot of times we don't know fully, because it hasn't been explored or evaluated, where's the implication? So, for example, Deb, what you're saying is, you can have a kid with an auditory processing issue who also has dyslexia. And in my experience, you can have a kid who has dyslexia with auditory processing challenges, but it doesn't mean they have a primary auditory processing disorder. And then you can have a kid that has auditory processing issues with social challenges. That doesn't mean they have autistic spectrum features. And often, well-meaning professionals and districts are everyone's doing their little piece, and we're getting a snapshot of the piece, but it's how do we put this whole puzzle together so we know what to do to support a child?
Well, I feel that interprofessional collaboration is just absolutely essential, that we talk to one another as professionals so that we can talk to the parent and talk with the parent, because they're part of our team too, so that they understand that we're not all working in silos, that we have the opportunity to really make a difference collectively in the outcome for this child. Because that's what does happen, is we all do our little piece, but my personal professional behavior pattern is to collaborate as much as I can so that collectively we make good recommendations and we're not just treating a bunch of symptoms.
And so if I have a child who's struggling or might be struggling, or let's even say has been identified, we always talk about two different categories. There's accommodation and then there's intervention. Right? And then for you listeners, when we talk about accommodation is where we do something differently to support a child's learning and processing, where intervention is something we do to actually improve a skill. So, Deb, can you say a little bit about each of those and how to help a child with an auditory processing issue?
Sure. So I think that the best assessment battery is when a child sees, say, you, and gets a really good psychoeducational or neuropsych eval, and then say, for example, I do a comprehensive assessment, and then in an ideal world, we can get the instrumentation done by an audiologist, but we can't always do that. So then we look at specific skills. What's going on? What can we strengthen? What will make a difference? And then what can we do immediately to modify an environment so that at home and in the classroom so that the child can feel some sense of empowerment to be successful, and the teacher can feel empowered to help that child be successful. But they're two different things. One's just modifying the environment, and then one, we have to go after how are we going to improve that. So there are things that can be done. It depends on what the problem areas are. So let's just take phonological processing is a big area. There are software programs or programs on the internet that can be used, but they require supervision. I don't like to just say, well, go do X, because then there's no clinical supervision. We want to monitor it. So there are such things as Fast Forward, Aerobics, Hear Builder. Those are ones that I recommend. And then there's sound-based therapies such as Tomatis, and we use that. That has great impact on a child's, say, their discrimination and their immediate memory and their working memory and their comprehension. And then there's a program called PACE, but the selection of programs is based on what the testing shows. So there's never a one-size-fits-all. It always is dependent upon what the data tell us and the decisions that we make. And then there's individual programs for reading and spelling, and most of the time we find that these children benefit from multisensory interventions such as Orton Gillingham or Slingerland or Barton or Lindemood Bell. But what is important for parents to understand is all of these programs take time. There's no one magic little bullet or a quick fix, that it's a process to get the processing skills so that they support good, successful learning and good, successful social outcomes.
And we always believe that, just understanding what's going on is over 50% of it, and then we can pick from all of these different interventions that you've mentioned. So there's a lot of tools that are out there once we know exactly what's going on.
Correct.
You talked about modifications and accommodations. It'd be helpful for the listeners to hear, what are a few things that you could recommend that happens in a classroom and happens at home to help a child who is having auditory processing issues?
So the accommodations, we always kind of, they're individualized as well. But one of the things is sometimes when kids have difficulty with processing, they also acquire some learned behaviors. So it's like high interest, low interest information, that high interest, low interest activities. So at home, for example, I help parents make decisions about when they're going to talk with their child. We teach parents to use what we call a recipe for a good listener. So when we teach them to say when they want to talk with their child, they'll say, Nick, it's time to listen. So when Nick hears it's time to listen, then Nick looks at the parent, stops what he's doing, doesn't touch, and then the parent knows then that they have to minimize any background noise, turn off the TV, turn off the music, turn off the computer, minimize background noise, and then give an instruction. So in that, with that example, you're removing distractions, both auditory and visual. You are gaining attention. You are adjusting the instruction for their ability. You're assisting them in starting and completing an activity, and you give them feedback. And that's the kind of thing you can do at home. And once you get their attention, you have to keep the information compatible with what their brain can process, store, and retrieve. And break things into chunks or bits, and according to what their brain can do. Same thing in the classroom, only in classrooms, sometimes the environment isn't particularly competent, so the student then has to be close to where the speaker is. If the speaker's moving around, then they have to develop a system for prompting and cueing so that the student can maintain their attention on the speaker. We teach kids to do a little bit of lip reading as well. Other accommodations is more time on tests, homework modification, classwork modification, pre-learning. That just means that a child can get some material that they're maybe going to be presented the next day. They get it a day early so they can become familiar with the material. To be able to work in a quiet place.
There's a ton of stuff that can be done, and that's where the hope comes with anything we're dealing with our kids, is that their bodies and brains are developing, and anytime we can get in early, and it's not too late, anytime we can get in to understand what's going on and then both accommodate and intervene, we are helping form the neural network system and the processing. And the thing that I wanted to really highlight what you're saying, and this comes up a lot on the show, is how busy everyone is and how much we all try to cram as much stuff into the shortest amount of time. And something you said, which I really like our listeners to walk away with, is breaking things down and sequencing things for our kids, particularly our kids who are having potential auditory processing or do have auditory processing issues. It's key to them being able to track and deliver and feel successful instead of feel totally overwhelmed.
You just spot on that, because what will happen is after children have year after year of frustration and lack of success, then at some point we have the perfect storm on our hands, because then you have a reaction, and the reaction is anger or just quitting and feelings of defeat. It really can get ugly. Then they can have trouble with depression and anxiety as they get older. Those are the complicating things that I see that I didn't see 10, 12, 15 years ago. And that's why the earlier the better, that we get in there and create environments for success for these guys so that they feel empowered to be successful.
I love that. Empowering them to be successful by creating a situation for success. And of course, that all comes back to us being more aware about ourselves, about our kids, about our relationship, and what the needs might be. And that brings us to our Parent Footprint moment. This is what you, Deb, have been waiting for. Our listeners love this part. So the Parent Footprint moment is when you became aware about something in yourself or in a parenting situation where your child benefited from this awareness?
Well, I'm the mom of 4 children. I have 2 daughters and 2 sons. And I learned really on to have the utmost respect for my children as human beings, because it's our job as parents to get them from little people to big people with confidence and joy in their hearts. And so I learned very on that I had to keep my words and my actions honorable, because they are watching all the time, and to be consistent in all that I do, to model my standards and my values. And it's come back full circle where they have told me, good job, Mom, for doing that.
That is beautiful, Deb. I just got the, I just got the chills there. To focus on respect for these beings as human life forms, and being aware that your job in guiding and ushering them through life is to actually treat them with respect and dignity so they have the same for themselves and others.
That's right. That's right.
That is awesome.
Thank you.
Well, everyone, I want to thank Dr. Deborah Ross-Swain for joining us on the Parent Footprint Show. I want to also mention an incredible resource, a book that she has co-authored called Auditory Processing Disorders, Assessment, Management, and Treatment. And I'm looking at this ginormous volumed book that is green, for those of you out there who are visual. And she's going to be starting to work on the second edition soon. She is truly an authority in the field of auditory processing. And most important, she is a wonderful person who is making the world a better place and helping families for decades. Deb, where can people learn more about you and your work?
They can go to our website, which is www.theswaincenter.com.
Check it out, everyone. She is an amazing resource. I want to thank you all for tuning in on the Parent Footprint Show with Dr. Dan. This show is sponsored by Parent Footprint. You can learn more about us at www.parentfootprint.com. If you'd like to email us, you can email us at podcast@parentfootprint.com. And as always, I will leave you with this question: what footprint do you want to leave?